Okay, let's go ahead and begin our meeting tonight. We would like to welcome everyone to the McDowell County Board of Commissioners boardroom, and we always begin our meeting with a prayer and a pledge. I would like to ask everyone to stand at this time, and Commissioner Brown will lead us in our prayer, and Commissioner Green will lead us in our pledge. Commissioner Brown, go ahead, sir.
Let's bow our heads. Father, we thank you for this day, and we thank you for all your many blessings. We thank you for hearing our prayers and answering them. And we thank you for this group that is gathered here tonight. And Father, we pray that everything we do tonight will be to uplift our community and our county. And God, we pray that you'd bless and have your way in each life. In Jesus' name, amen.
Amen.
Attention, salute, pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. You may be seated. Gentlemen, at this time you have the minutes before you. What's the pleasure of the board?
Mr. Chair, I make a motion to approve the August 14th, August 21st, and approve and seal the closed session of August 21st minutes.
Okay, you've heard the motion. Do we have a second?
Second.
Discussion. All those in favor of the motion say aye. Aye. And opposed, like sign. Gentlemen, you have the agenda before you. At this time, are there any additions or deletions to our agenda as presented? There being none, what's the pleasure of the board concerning adopting the agenda for tonight's meeting?
Move we adopt the agenda.
Okay, second.
Second.
Discussion. All those in favor of the motion say aye. Aye. Any opposed, like sign.
Motion in second.
At this time, we'll move right to our first appointment. We have the distinguished duo of Mr. Kehler and Mr. Walker with us tonight. Mr. Kehler, come forward, sir, and we know you're here to talk about 3 emergency items. So, sir, the floor is yours.
Well, as always, we appreciate the opportunity to present in front of you. And tonight we've got 3 items on the agenda. We'll start with the first in recognition of Emergency Preparedness Month. I'm going to ask Deputy Director Walker to come forward and talk about preparedness on the fire side and then finish for the severe weather.
Okay.
So as most of you know, on the Fire Prevention Week, that's the October 8th through the 14th. Our fire departments have a huge undertaking they do with all the schools in the county. Each fire department takes a school. The association has the actual smoke trailer that we use that we've actually, the association's actually bought a new trailer to help with that program also we're really excited about. But unfortunately, in McDowell County in 2015, in December, within about 6 months, we had 5 fatal fires in the McDowell County, actually in the southern region of McDowell County. Some processes was put into place. After that, majority of the volunteer fire departments wanted to do something to try to cut them numbers. That's certainly way too high for our county to have. They kind of went together in a partnership with Red Cross with some smoke detectors, and they don't just give these smoke detectors out. They actually take their Saturdays and go out and install these smoke detectors and educate the people. Had great numbers with that. Roughly 500 smoke detectors was put into place within a year on that, and 75 of them was CO detectors. Also was some hearing impaired detectors for people that was hard of hearing. So this year, as always, we're still trying to work on the fire prevention, and the 3 main objectives that we're trying to go with is close your door, check your smoke detectors, and have an escape plan. The one new one that a lot of people don't hear is close your door. The reasoning for that is UL's done, about the last 10 years, a lot of studies on house fires and fatal fires. And roughly 3 out of 5 structure fires that are fatal have no smoke detectors. Number 2 on the studies was people was keeping their kids' doors open, keeping their bedroom doors open. The difference in that on a fire that they done a study on was a difference of 100 degrees in that kid's bedroom to 1,000 degrees whenever it was open. So that's the 3 approaches that we're trying to go for this year as far as in fire prevention. One other thing that's on everybody's mind is wildfires. We've worked real hard with U.S. Forest Service and North Carolina Forest Service doing some mitigation work, particularly in developments and areas of concern on hillsides of some of these structures that could be prone for wildfire. U.S. Forest Service actually had a community mitigation assistance team come in a couple of weeks ago, and they had some meetings. I think they had some meetings with the county manager and maybe some of you guys to try to come up with a plan to come up with some mitigation, also some grant funding to do some work, not only to do defensible spaces around structures, but hardening of the homes on the vents, the guttering, things like that, to where these houses are prone to structure fires in regards to wildland fire. So that's kind of what we're doing on the fire prevention side of the Office of Emergency Management. You got any questions? All right, thank you.
Thanks, Craig. Appreciate you.
Appreciate what Craig does on a daily basis. He's a huge team player in our division, and while he presented the fire side, he works in preparedness across all of the different sectors. With the recent Hurricane Irma, most folks that has been on the minds is preparedness for severe weather. That is one of the things that our office focuses on during the month of September as well. And we certainly have hit hard hurricane preparedness. We know hurricanes pose inland flooding threat, high wind damage, as well as tornadoes that are spun in the right front quadrant of the hurricane as it comes aboard. And 2004 is probably on the minds of a lot of folks when they start talking about hurricanes, when Francis and Ivan caused some devastating flooding in McDowell. So I think our message during the hurricane was what we try to message throughout the entire year is preparedness isn't just 72 hours before a storm. Preparedness is a 365-day-a-year event, and making sure that your family does have a 72-hour emergency supply kit at all times, whether it's a tornado, a snowstorm. And there's simple things such as ensuring, especially elderly folks or those on prescription medications, have enough meds to last through an event or a storm. When we see snowstorms here, that's one of the calls that taxes our emergency medical system the most is people run out of blood pressure medicine, run out of diabetic medication in the middle of a storm, and it requires emergency crews to go out and assist that person. Food, water, non-perishable food supply for 72 hours is just the basic necessities that we preach. So the tropics are still busy, and we'll continue our message throughout the month of September and then transition into winter storm planning and get that message out to the public as well through our social media routes and other forms of communication. So the office is busy for preparedness, and I think Benjamin Franklin said it best: by failing to prepare, you are preparing to fail. And that's what our office follows, is preparation to the max. So with that, any questions? We'll move into the next item if that's acceptable.
Yes, sir. Go ahead with it.
Behavioral health transfer contract with McDowell Hospital is the next item that we've brought forth to you. This is a result of increase in behavioral health transfers. To give you, and those that may be watching at home, the backdrop or the history of this project is we have seen an increase in the number of behavioral health patients that are presenting to the emergency department, who in turn are requiring transfer due to capacity issues at the local ER up to Mission Hospital. These are patients that have been medically screened. They do not have a medical emergency, but they are being held under involuntary commitment or voluntary for behavioral health services. So in turn, this was putting a strain on the EMS division because we were utilizing an EMS ambulance to transport these patients along with a sheriff deputy if they were under involuntary commitment to Mission. And this was a process that Mission's risk management department wanted them to have medical monitoring while en route, along with the sheriff deputy. So when we looked at this process, it does not need, we felt like it did not need 2 paramedics and an ambulance. We were dedicating more resources to that call than what was needed. It wasn't efficient. However, the hospital was being billed direct for these calls for service because it's being transferred because of a capacity issue. So working with the hospital, we proposed a more efficient plan to utilize our community paramedics who drive SUVs. These are patients that aren't required to go in an ambulance. They are not, as I said before, they do not have a medical emergency. and it's strictly being transferred for capacity issues. So the proposed contract in front of you would allow us to transport behavioral health patients in a community paramedic vehicle for a contracted rate. As I stated, they have been medically screened by a physician, and there's no medical emergency. I think the key to this project here is both of our community paramedics at this time are sworn law enforcement officers with the Sheriff's Department. And we have worked even today with Captain Crisp and the Sheriff and Chief Deputy Buchanan to where training our community paramedics to serve the IVC paperwork and take care of that keeps a deputy from having to accompany these patients going to mission. So we've got a much more efficient process in utilizing the resources more efficiently, and then we will receive reimbursement after we bill the hospital direct for these transfers. So I think it's a win-win situation. We're transferring them in a more secure vehicle than an ambulance is. There is opportunities to escape from an ambulance because the doors are not secure like they are in an SUV that the community paramedics drive. It's got audio-visual capability to where they can constantly monitor the back seat, and it's a secure environment that promotes safety for our employee as well as, I think, the general public. So with that, I'll be happy to take any questions. I will make one point. The Community Paramedic Diversion Project, which instead of an ambulance responding to psychiatric calls for service, we're sending the community paramedic first to essentially triage a situation to better utilize our resources. And to date, we have diverted 82 patients from the emergency department and got them to mental health services immediately instead of transporting them to the ED where they may sit and wait for psychiatric services for hours, if not days.
Yeah. So prior to the community care paramedic program, one EMS unit and then law enforcement would be together to on any transports, correct? So with the since the community care programs in place, and since you're cross-training the EMS personnel to have the certification, that would just be one person, which is great. I mean, I think efficiency is great. That speaks volumes, Win, for how you operate your staff, Craig. I mean, that efficiency is just unbelievable.
Yeah, to summarize at home, folks that may not have followed what I said is the before picture looks like an ambulance, 2 paramedics, and a sheriff deputy. So 3 personnel and a $200,000 apparatus, and we've moved it to 1 personnel who's got duly sworn law enforcement officer and a community paramedic in a $30,000 vehicle.
Can't beat that.
Plus reducing the cost of your fuel, mileage, wear and tear.
That's correct. So there'll be additional savings on fuel and maintenance as well.
The
You're
question
keeping that unit in the county for an actual emergency.
Yeah,
question I've got is the community care program. That's predominantly grant-based, correct?
that is correct.
And how many years do we have left on the?
So it's in its final year, and I
Which
hope
ends in when, William?
it'll be June 30th. It'll end fiscal year 18.
Fiscal year 18. Is that why, my next question would be this, I know the $300 that has been a contract with Mission, is that money going back into that program for when or if that is not grant funding available June of 18? Is that the purpose of that money? Because the question I had was, I asked Barry, I said, why do we not keep that, put it back over to your side and not the community care paramedic, even though it's probably still under your umbrella? I get that.
So I haven't specifically addressed that with Ashley or Allison at this point. What I can tell you is I hope to take to the county manager in the coming months our plan for fiscal year 19. But the diversion projects, or the diversion pilot that we're in with the state, there's 12 services in North Carolina, McDowell being one of 12. It was the only one in Western North Carolina to do or behavioral health diversions. That reimbursement funding is going into a sustainability fund. So we are building that fund to help sustain the program.
Did you say one of 12?
One of 12 in the state and the only in Western North Carolina.
Wow.
Well, that makes it easier for me since we knew that money's being banked up to where in the event we don't get the grant funding, you can still operate it because it's very efficient.
Yeah, I hope to have to actually, in 30, 60 days, that business plan going forward for this program.
How much per month do you estimate that to be?
I think on average, we were doing 5 behavioral health transfers a month. I mean, the volume's not low, but I can tell you today we've worked closely to where we had 3 prospective transfers pending. We've done 1 so far, and we have 2 more pending today that could go under this program.
Okay, other comments, questions? Mr. Wooten, what direction are you requesting?
I request you approve this contract, 'cause it's a great arrangement for us as well as the hospital.
Okay, what's the pleasure of the board?
Make a motion, we approve the transportation service agreement between the hospital and McDowell County.
Do we have a second?
Second.
Discussion, all those in favor of the motion say aye.
Aye.
Aye, any opposed, like sign. And I will say as a footnote, we appreciate Mission and their partnership in this.
Yeah,
Okay.
McDowell Hospital's, Carol knows behind me here, and she's been fantastic to
I
help
thought I
push
saw her
this
back
through.
there.
William, I appreciate and want to commend your staff and the partner agencies during the recent hurricane and how y'all came together. I'm glad I was there to see that.
I appreciate that.
That's a great segue to the first reading of the policy, that's the next item, I think.
Yes, and that policy was not in our, I didn't see it. Was it in there?
It should be
27.
page 27. It's
Okay.
very short, it's just a paragraph.
Oh, that was a policy? Okay.
Yes, sir.
Okay.
Very, very, very short.
Overtime
Okay,
policy.
I saw it.
Trying to be efficient.
Official words.
I was looking for about 12 or 13 pages here, but yeah, that works.
Oh, no.
Okay, first reading on the policy.
Yes, sir. If William could overview it.
So, Hurricane Matthew, we had a number of individuals that were deployed during Matthew, and coming back and looking at our policy, we had in the emergency services procedural manual the overtime, how overtime is paid for employees that are deployed during a disaster or when a state of emergency is declared, and there will be reimbursement. And it covers exempt as well as non-exempt employees. So it's more of a formality moving it into the county resolution instead of just our emergency services procedural manual. I think it cleans it up, and moving forward, it shouldn't have to be reviewed or considered once it's moved. And the thing with the exempt versus non-exempt is this is, so in Matthew, all of the expenses that we had incurred during the deployments to all 3 counties were reimbursed. But same thing as we've done in Hurricane Floyd and some of the other deployments, this just makes it more of a formality to get it in the county resolution or the county handbook.
Okay, comments, questions?
Again, this is a first reading, and we'll bring it back next month for approval if you don't have any changes for us.
Ms. Kehler, we appreciate you being here tonight. Your
Thank
staff does an excellent job, and Craig, thanks for all you guys do day in, day out.
Thank you much.
Okay, let's move to, well, we are a little bit ahead of, let's go to our 515 appointment. This is the landfill gas monitoring electronic recycling fee, two items there. Mr. Wood, go ahead, sir. Is Randall here?
He is, and while he's coming up, I'll just preface the first item. This is maybe the bigger deal to talk about. The state has, they inspect closed landfills, and obviously we have one that closed, I think in '94. Could be a year or 2 off, but we have to monitor the garbage that's capped there for forever. And so part of that is monitoring the methane that is generated by the decomposition of that garbage. And I know we're talking about health and insurance, all kinds of things. We're talking about garbage now, but it is important for the environment, I guess. But the state does require that we have a landfill gas monitoring plan. And we have worked with our consultant, Joyce Engineering, for a couple of months to develop a plan, and we talked to them before the end of, before this fiscal year, because we knew this was coming, this contract. And Randall testified to the fact that we asked for a cost, some sort of estimate. What are we looking at? Ballpark it for us, because we don't do this every day. You guys do. They would not give us any ballpark price, and so we have a little bit in the county budget, and so we can get into detail. But essentially, we had no way to plan for what you see before you because we couldn't get the information. So Randall can talk about again the detail why we have to have this, and we'll touch base on the contract. But
thank you. Thank you for letting me have the opportunity to come speak to you today. I've got the Joyce engineer proposal plans for gas monitoring.
Thanks, sir.
Sure.
thank you, Randall.
As Ashley said, we've been in contact with them. We've been on conference calls, and I've dealt with them directly coming to the landfill. They've come and monitored our gas, methane gas coming out there, and it is exceeding, it's above 5%. And that's where we're at on that. It really started when the state inspector came back in April, and he wanted me to go ahead and get this in plan to get us in, get a proposal to get us in the regulations, everything for the state. But the North Carolina State Management Regulation 15A NCAC 13B states that the owner and operator of a closed landfill shall take the measurements necessary to ensure that the closed site shall continue to meet the design standard for landfill gas found in Rule .05032A. The North Carolina Department of Environmental Quality, DEQ, requires a minimum of quarterly monitoring of landfill gas to ensure compliance at the facility boundaries and on-site proximal structures within 1,000 feet of the waste. And like Ashley was saying, we had Joyce Engineer come, and they done a final draft. We got that approved, got everything done on that, and that's what you have before you today. That's on the closed landfill. Here are their recommendations to get us in compliance with NCDOT. They're asking we drill 12 wells from GP1 to GP12 with an all-terrain vehicle, accessing geographic characteristics and subsoil and the soil and drilling activities, installing 12 grass probes, GP1 through GP12, constructed with a 2-inch PVC riser and screen. The screen intervals shall begin at 5 foot below ground surface and extend to the total depth of the boring. The probes will be completed with concrete pads and lockable protective covers. The landfill gas probe completion reports with boring logs, probe construction diagrams, and facility drawings showing the survey locations of the new probe. Now the survey is not considered into this fixed fee. And the reason they do that, when they deal with other counties, they said other counties like to deal with their own local survey crews. They will get the survey crews, but that is an extra fee, and we'd have to get that. Once they get the wells drilled, we'll have to get a surveying crew to come and mark that for a GPS map so that they will be sited on the map. The 12 probes will be installed within 90 days of DEQ approval of the landfill gas monitoring plan. The landfill gas probe completion report will be submitted to NCDEQ within 30 days of installation. The compensation for this, not counting the survey because that's an extra report, will be $33,900.
Okay. Ashley, anything you need to add?
And again, we have I think it was $5,000 to $8,000 budgeted in this line item. We had, again, no heads up on what the cost would be. We are under the gun as far as moving forward with this plan because of the state requirement. So in order to move forward, we will probably have to appropriate fund balance to do this.
Is there other providers? I mean, is this Joyce Engineering? What's our obligation?
They have been our long-term landfill engineer for probably the last 20 years. It's not something that's very common for engineering companies to do. Like a McGill Associates, for example, wouldn't be in this business.
And there weren't any obligation to go ahead and have more than one bid on this?
Not for a professional service.
Gotcha.
Also involved into the price too we'll always have to do quarterly monitoring. George proposed to provide quarterly landfill gas monitoring at the 12 boundary probes and on-site structures in accordance with the county's landfill gas monitoring plan, once approved by North Carolina DEQ. They will do all the monitoring. They will submit that to us as the county and also to the North Carolina Department of Environmental Quality. This fixed fee for every quarter will be $1,325 with an annual fee not to exceed over $5,300. Now, that is in accordance with if we don't have to have any methane gas burn off or retracted. That is an extra fee. This right here is just to keep us in compliance with that, to make sure that we're monitoring. Any gas that has to be retracted from the landfill, that is an extra fee for that.
So what we're asking for you tonight is approve the contract with Joyce. That would do the installation of the monitoring wells and the annual monitoring process.
This price would be drilling and installing the probes
Right.
for
That is
the
correct.
wells G1 through G12.
And it also, he mentioned any structure that's within 1,000 feet of the waste, there has to be a monitoring device. So those will be placed on the county buildings nearby and the DOT buildings that are nearby.
It will exceed all the way to the facility maintenance building down there too. It will get the North Carolina Department of Transportation buildings too as you come up the driveway.
How long will those 12 wells or the drilling spots be good for?
Should be good
Indefinitely.
with not long as there is not any damage or anything.
So really, we're just experiencing one.
That one-time hit.
One
for
time
that.
hit.
Yeah.
Yeah.
Only thing that will be that I'll have to budget every year within my budget will be the annual monitoring.
Yeah,
Yes,
gotcha.
that's correct.
Which is 5,300.
The annual fee will be $5,300 on that. That is if it don't exceed, we have to do any gas retraction or have to have any other fees for that.
Well, if you drill a private well at your house, you're probably gonna spend at least $5,000 a minimum. So if you got 12 wells, that's $60,000. So we're saving money. Our health director is here tonight. She probably lend
All
some
about well drilling.
more words concerning that. But anyway,
Yeah, the project involves monitoring each of the facility 12 boundary probes and the 10 building identified on Table 1 of the landfill gas monitoring plan of the GEM 2000 and compatible gas monitoring devices. And that's ones that they will be monitoring every quarter. Like I said, they will send us the report, and also they will send it directly report to the North Carolina Environmental Quality too.
It's been checked and monitored on probably a lower scale for many years anyway, hasn't it?
Well, when he came and brought his machine down, anything over 5%, the state requires that it has to be, something has to be retracted, but he was going to right in the vents inside, right in the middle of the landfill. And these probes will be set up on the outer boundaries of it where they require us to do it. So it's going to be more right in the middle of the landfill than what it will be on the boundaries, seeing the boundaries. But they don't know exactly how much we got until they drilled past the depth of the waste that's there. And it will also identify where our edge of our boundaries are too, where the edge of the waste is. They'll know where it's at too. So that comes along really where they're going to be drilling the well, and we'll know where the exceedance of the boundaries are too with that.
A couple of board members were on the board when we looked at doing, converting the methane gas to energy.
profit, yeah,
And when we did the tests back then, it was been about 10 years ago, there was so little methane, it wasn't worth the effort. And so our guess is that there's not a lot of methane that's going to require burn off or anything. That's our hope.
All right, what's the pleasure of the board?
Make a motion, we approve the landfill monitoring plan with Joyce Engineering.
Okay, we have a motion, second, discussion. All those in favor of the motion say aye. Aye, any opposed, like sign. Okay? Let's go to the second item, Randall. Go ahead, sir.
Okay, the second item I have on the agenda is the proposed fee for schedule for electronics. This is something that we pick up, we have, some weeks it can vary. We can have a load per week, and then it might go 2 weeks that we'll have a tractor and trailer load of electronics. But we're proposing tonight that all the other surrounding counties, and I've got the proposed, like for Rutherford County and for Blenco County, they charge a fee to bring in electronics to dispose of. And right now, what we have in place is just about, it's like the way we do for our trash, just make sure we're residents of McDowell County, make sure, if it's commercial, if it's residential. as long as you got proof to your residence in McDowell County, you can bring your electronics there and it don't cost you anything. We're proposing tonight to help offset some of the costs for that, what it costs us is to get rid of the electronics. On the regular flat screen monitors, TVs, the LEDs, the plasmas, and also the computer, just a regular $5 fee for that. And the old construction, the old tube monitors, and the TVs too, that's got the electronic tubes in it, that does cost more for us to get rid of that. And I propose if you have that, it costs $10 to bring that in to get rid of that.
And again, this was precipitated by a state law change a number of years ago. I think the hope and the goal of the legislature was that there would be a robust environmental recycling business that would spring up from this. And what happened is, originally all this was sent to the landfills and they redirected it towards recycling. But what was happening is these were piling up in counties, including ours. Your recycling companies were starting to dump them in China and Mexico and different places, and they weren't being recycled there. And so there's a very large handling fee now that's being charged, where before I think the state thought it would maybe be free or we would be paid. And so we're paying thousands of dollars a month to get rid of these.
And you said, what, $2,000 to $3,000 a month?
That's right.
It's it can be up to that much per load. If we have one load per week go out, it can be up to like
Could be even higher.
$5 per tractor and trailer load.
How many loads do you average a month going out?
Well, here recently we have seen an increase in it. We've been having a load per week to go out.
So that's the low end, the 2 to 3.
Well, tell us a brand so we know not to buy the brand that's in there.
Yes, usually we put 24 pallets on the trailer, and it all depends on what's on there. It costs us more than what the other ones, but it can be anywhere. It can be anywhere from $1,500 to $2,500 per load.
Can that be crushed and put in containers, or does it have to be?
No.
What?
And anything in a line landfill, it will not. It's not acceptable. No, it has to go to a recyclable place to where they can get what recyclables they can.
So if a city brings that in, how do we, I mean, of course, I'm gonna live in the city, so if I set a TV out on the side of the road, the city's not gonna charge me the $10, or you're not gonna charge me $10. So we city residents are getting out scot-free, right?
You know, we pull that out within that trash stream and put it in where it properly goes to. Is how
But we're not paying for that then?
no.
And the city's not
But
paying
we
for
need
it.
to-
The greater question is, the city's not paying to have that.
Yeah, I'm
problem.
saying, me as a city taxpayer, I'm not paying for that. So
We're going to have and we've raised the topic with them, and that will be a good utility committee item. And so they're aware of the discussion tonight, and it may be that city residents may have to make the drive down to Randall's facility if that's the case.
Yeah, the city residents, if they don't put it in on curbside service, they can bring it down to the landfill to bring it to the office, and then it goes into the proper electronic container to be shipped out.
They can just bring it to your yard.
Bring my yard. I'll charge them $10, 15 to do it.
Sure.
Make money out of it.
Okay, so you're asking us to approve the fee schedule for the electronics?
Yes, sir.
Yes, sir.
All right.
Do you have any other questions or anything?
And
About the
I should
electronics.
note that these items are based on what is allowed in statute. So there are some things that aren't enumerated in the statute, that like mice and keyboards, we can't charge for those, but these are the items. And it specifically says printers, scanners, computers, et cetera. So that's.
So now, if you got a load, you're a private citizen, you have a load, you got a truckload full of stuff that's non-bagged, you cross the scales and pay the fee of what, $4?
$5.
$5 now? All right, $5. In addition to the $5 fee, you're going to pay another $10 for the computer monitor or TV, or $5 more for a flat screen, and so forth, right?
Yes, that will be.
There better be a good educational campaign and rolled out, because if not, our phones will ring off the hook concerning this. I've seen it when we had $2 fee and went to progressively up, and
We've
people
all
don't
gotten
like
those
that.
calls, I think. These items have been diverted for, I think, 3 years from the landfill. So there has been an educational aspect on where to take them, but not necessarily to take your wallet with you. And so, again, we do charge for more than 5 tires. and a number of things at the Public Works office. So they're prepared to take funds there.
This would be a good item to run in the newspaper, that way people be aware.
We'll do that. We can delay implementation, or we could do it tomorrow. It's up to you guys.
But the thing is, they look at us and say, well, if they compare us to Buncombe County or Burke County, it's not fair to compare. But if you look at fees, you're gonna pay $40 to throw your trash away versus where we're going across the scales is $5.
What does Rutherford County charge? They would be bigger than us, but more similar in size.
It's, on their electronics is $5 and $15.
Okay.
For the tube top computers and monitors, it is $15, and it's $5 for the regular TVs.
Okay.
A far bigger problem than that I hear is the fact that non-residents and non-taxpayers use our facilities all the time.
That's something we do. We try to monitor. Every time anybody comes across the scales, we ask for proof. We have signs coming up there. We ask for proof for residents. On some of our convenience sites, we could see some of that come in but they do have the right to ask for their license to make sure they have proof of residents coming into the county. That's correct.
Okay, are there any other comments or questions? There being none, what is the pleasure of the board?
I'll make a motion we approve the fee schedule for electronics.
Second.
Discussion? All those in favor of the motion say aye. Aye. Any opposed, like sign.
And you will be
Okay.
working with the city on collection from, I'll pay my fair share. I don't get rid of my stuff, though. It's
Okay.
only fair.
Okay, Randall, thank you,
All right.
sir.
Thank y'all.
Have a good evening. All right, this time we have a 5:30 appointment. We have Mission Hospital with us, and we have Blue Cross Blue Shield with us tonight. Let me just lay a little bit of groundwork here as we begin discussion. Number one, this is not a public hearing, so people who are in attendance, if you're not with Blue Cross nor Mission, this is not a forum for you to be able to ask questions directly to either party. That's the first thing. Second, we're going to let each of the two entities go. We'll go ahead and have you come forward, and then you'll make a presentation. Then our board will ask any questions of each of the two groups. And then once we're done, you're done, and you're free to sit down, then the other group comes forward. There's not going to be a back and forth either between the Mission group and the Blue Cross group, okay? So it's going to be straight commissioners and each group here just to hear information and ask questions. All right, gentlemen, with that being said, Blue Cross Blue Shield, you get to come up first. Mr. Patrick Brady. And Mr. Wooten, go ahead and preface this real quick. That way people know why they're in the room. I think people understand why, but
I think so. There's been a little bit of news coverage on it. I won't rehash everything that everyone has read, but we mentioned last month, this is an important issue for the county, the residents. There are a lot of state employees in this county with the prison, the school system, DOT, et cetera, that are Blue Cross members. And it's important for us as an organization. Our employees and covered dependents are Blue Cross members. So it's important internally as well. So it's definitely something that we've all been monitoring. Our mailboxes, the news, the newspapers, et cetera. So is definitely hearing more information about it, I think, is in everyone's interest.
okay. With that being said, Mr. Brady, welcome to the boardroom. You're at Blue Cross. Anybody that is with you from Blue Cross during your side, you'll have 15 minutes to, I meant to mention that, about a 15-minute presentation. So anybody else you need to bring forward, feel free to do that at whatever time you deem necessary. All right.
Great. Mr. Chairman, Board of Commissioners, good afternoon. Thank you for having us here today. I'm Patrick Brady, Director of Major and National Accounts at Blue Cross North Carolina, and I'm here on behalf of McDowell County and our other customers in McDowell County. I appreciate the opportunity to address you today. You've been a very important client of ours for over 10 years, and we also value the great care provided by McDowell Hospital. So it is under unfortunate circumstances that we're here this evening. We know that Mission's termination of the contract with us is very unsettling for the residents of McDowell County. You've depended on Mission, you've depended on Blue Cross. And now there is in question whether the future will include Blue Cross and Mission together or whether there will be an out-of-network situation. Nobody wins here. And in fact, the members, our customers, are the ones that are left to sort this out. And I applaud you for being willing to try and bring that to light and understand what it means for the residents here in McDowell County. So with that, I want to take just a few minutes to let you know about our commitment to customers here, to communities here, McDowell County and the western part of North Carolina, and describe what we're doing to help our customers find other health care providers, and then to answer any questions that you might have. Blue Cross and Blue Shield of North Carolina is proud to have served our state for nearly 85 years. It's a commitment we take very seriously. We're the only health plan serving Affordable Care Act customers in all 100 counties. We are a not-for-profit company that is fully taxed, and last year we paid nearly $478 million in federal, state, and local taxes. Now, why do I mention that? Unfortunately, there's been a lot of figures thrown out publicly, and many of those have been inaccurate. So I'd like to clarify a few of those for you this evening. For example, Blue Cross, over the last 5 years, has averaged a 1% profit margin, largely driven by significant losses in the Affordable Care Act plans. We were as surprised and disappointed as anybody when Mission decided to walk away from negotiations and cancel their contract with us on July the 5th. We were even more surprised when Mission decided to cancel its Medicare Advantage contract, which wasn't even part of the dispute or the negotiations. They chose that disruption for seniors who need care here in your county, McDowell County, and the western part of the state. This dispute is about premium and health care costs that are already too high. Plain and simple. Mission Health has historically enjoyed guaranteed rate increases from Blue Cross, including every year of the previous contract that recently terminated. And these increases directly affect the costs of McDowell County's employee health plan. In fact, the increases Mission has proposed to us would add about $85,000 a year to the cost of the county's health plan. We've offered Mission a contract that allows for increases tied to quality and health outcomes. This is the same offer that over 40 hospitals in our state over the last 2 years have accepted. That includes many of Mission's peers, most of which have lower reimbursement levels to begin with. Because they canceled their contract with us, Mission will be the only health system in North Carolina out of network with Blue Cross as of October 5th of this year. So what's next? We turn our focus to our customers. All Mission Health hospitals, outpatient facilities, and most professional providers will be out of network beginning October the 5th. 3 things to keep in mind. First, there is a continuity of care program for customers who are pregnant or in a current active course of treatment. Those customers may continue seeing their current providers at Mission Health facilities for a period of time, and it will be at the in-network level if it is approved. We've mailed letters to those that we believe may qualify. Customers may contact us directly. Even providers, on behalf of their patients, can apply for this continuity of care. So the bottom line here is we're committed to helping customers find the health care that they need. We have 100 nurses who are working on this important effort on behalf of your residents. We have a number of alternate hospitals and doctors in the network that are local. For example, Carolinas Healthcare Blue Ridge in Morganton is an option for McDowell County employees. If I'm correct on this, it's about 23 miles from here to there. And if I look at the county's health plan, twice the amount of care goes there now than what goes to the local hospital. So it's not unprecedented that care would go to CHS Blue Ridge. Secondly, if there is not a provider within a certain travel radius, we can also approve an in-network service. For example, for what we call high-frequency providers, such as a cardiologist, the standard is one provider in 60 miles. So those same 100 nurses would help that member if that member feels there is not an adequate provider, one within 60 miles. If it is a high-impact provider, such as oncology, cancer treatment, within 90 miles, the same would apply. We can approve that service at an in-network rate. The data, just to give you some peace of mind here, the data for McDowell County shows a lot of care, as I mentioned, already going elsewhere. So in addition to Carolinas Healthcare Blue Ridge, we have gastroenterology. 100% of care goes to non-mission providers. Dermatology, 100% of care. Oncology or cancer radiology, 100% of care. So overall, this decision affects 9,400 members in McDowell County alone and 260,000 members in the 16-county area served by Mission. 73% of those members are in employer self-funded plans. That directly impacts these local companies' bottom line. Again, we were as surprised and disappointed as anyone with Mission's action. We stand ready to work with them on a new contract. What will need to happen for that to proceed is Mission's termination, submitted on July 5th, would need to be rescinded so that we can come back to the table and continue negotiations on your behalf. In the meantime, our focus is on making sure customers understand their options and that they're able to receive the care that they need here in the western part of the state. So with that, I thank you for your time and welcome any questions you might have.
Okay. Gentlemen, questions?
The data that you just provided, can you provide that in writing to us?
Yes, sir. Question was, can we provide the data? Absolutely. We have it this evening, but we can certainly share it with the HR team.
Other comments, questions? Patrick, is there anybody else with your group that wishes to speak? Or
No.
okay, all right, good enough. Okay, thank you, Patrick, and Blue Cross for being here tonight. And so at this time, we'll go ahead and move to the mission group. And we have Jill Hoggard-Green, and Carol's here. And you can introduce whomever else you want to speak tonight, okay?
Good evening, gentlemen. And I wanted to make some opening comments. For those of you that don't know me, my name's Tim Blenco. I'm the volunteer board chair for McDowell Hospital. And in some of these opening comments, a couple things I wanted to mention is in the 8 or 8.5 years that I've been in this community, I've done my best to get extremely involved, and I've had the pleasure to provide leadership to the Good Samaritan Clinic, to the McDowell Health Coalition. Actually, thank you guys for taking the step that you guys did with transportation, but I've had the honor, I guess you could say, of serving on your transportation planning committee for about 7 years. But one thing that has always, I think, been the most meaningful and kind of one of the most profound things in this community is that we are a very responsive community, and McDowell County community matters. And all of those initiatives, whether it's trying to improve the health of our community, trying to make sure that uninsured folks had a place to go, McDowell Hospital and Mission Health have always been there for us. McDowell Hospital is our community health system. Mission is the kind of overarching group that has given us a lot of the steps that we've been able to take. in this community, we also understand that we have a lot of challenges as it relates to our health. We've got some very challenging demographics, and I don't think we could have asked, at least from the community-based organization standpoint, as we're trying to, again, build a health coalition to address some of these population health issues. So we could not have had a better partner than the folks that we have had with McDowell Hospital. They have been in this community. Their commitment to improving population health is as strong as ever. And this is a situation where if we want Mission Health and if we want McDowell Hospital to be serving this community for generations to come, now is the time when we've got to stand together as a community and give them the support that they undoubtedly deserve. So with that, I know Jill's got quite a lot of information to share with you guys, but just from the community-based standpoint and as a member of this community, I wanted to let you guys know that we need our community support as we move forward with this. So with that, I'll turn it over to Jill.
Tim, I see, real quick before you continue, you got several of the hospital board members here locally, right?
Absolutely, we do.
Yeah, recognize, if you don't mind recognizing those people real quick for us.
Absolutely. We got Jed Rakin in the room. In terms of other community board members, there's Harold in the back, and Ray McKesson is here as well.
Okay. All right, thanks, sir.
Thank you, Mr. Chairman, and thank you, Tim. We so appreciate this, and I appreciate the opportunity to spend a few moments with you and share our perspective. You know, at Mission, we know it's an honor to serve you and your family and this community and all of Western North Carolina. We have 12,000 physician, nurses, caregivers, team members working together across the 18 counties every day, providing access to what is nationally recognized some of the highest quality, safest, compassionate, and efficient care in the country. And I would love to be here spending most of our time talking about how we can continue to work together to create innovative solutions just like the one that Director Kehler shared this evening, or whether it's the opening of the new hospital that is a $47 million investment and that Carol has promised me that it's opening late winter, February 23rd. We'd love to be talking about Mission Health Partners, and Mission Health Partners is a concept that I'm going to talk about in a few minutes. Mission Health Partners consists of all of our hospitals and several others, and in addition, there's over 1,000 clinicians. About 300 of them are primary care docs. The rest are specialists, and that network has been working together to make sure that they not only make sure that you're getting the best care when you're ill, but they've been focusing on helping you be well, which is all the prevention activities, getting well, which is giving you that state-of-the-art, high-safety, high-quality care, as well as working with you in innovative ways to manage chronic disease. As Tim talked about earlier, to really help you move the cost curve. And I can speak from actual use of the services as well as the outcomes. Our employees at Mission Health are on Mission Health Partners. And Mission Health Partners this last year, we have now for the first time seen the cost curve for our employees getting extraordinary care starting to go down. So I'd love to spend a lot of time talking about those things that we can work together on, or to just recognize the outstanding care that happens at McDowell. And for the 5th year in 6 years, no other health system in the country has achieved this. The Truven Analytic Group, who look at our outcomes across the country, all health systems, have rated Mission Health System as a top 15 health system. Now, that's not just because we're good. It shows every year that we're improving. And that's on quality, safety, and cost effectiveness. So I would love to be spending time on this, but unfortunately we're not. We're here to talk about an issue that's extraordinarily serious. And after 8 months of good faith negotiation, and I can tell you honestly, our teams were at the table, and even Dr. Paulus went to meet with the CEO of Blue Cross Blue Shield. So there should be no surprise. There were very dedicated conversations about here's what the needs are in Western North Carolina. Here's how we could work together in an innovative way to change those cost curves. Despite that, there was no movement, and put us in a position that puts at risk access to the wonderful services that you have come to know and count on in terms of improving the health of your families. So what got us here? Blue Cross Blue Shield's negotiation, or their lack thereof, they use a 3-part strategy that is intimidating and we see as bullying. Number one, you have to have a contract that's evergreen, which means it's an auto-renew. So if they don't decide they're coming to agreement, it just goes on forever until there's an agreement. So for them, sitting back and saying, we're going to take our time, that sets up a zero increase as you go through those conversations. Number two, and this one's quite interesting, it's actually illegal in over half of the states. If you do go out of network, they threaten, and we've had lots of examples of threats, they threaten that they're going to send the resources or their reimbursement directly to the beneficiary, and then just forget it, you're never going to see those reimbursements. And third, which I think is probably the worst one, is, and it's nonsensical, they basically say, if you give us a deadline, and that's what we did, is we gave them a deadline. There was no progress. We said we have to have a deadline, and the only way to give a deadline to the negotiation is to give a notice of termination. So they say, if you give us a deadline, we will just choose not to talk to you. We think that's nonsensical, and know that we stand ready. Dr. Paula said he keeps his phone on 24/7. He will go anytime, anywhere to continue the negotiations, but there has to be a deadline so that we make the progress. Now, despite that intimidation, we decided to give the notice of termination, and that's because it's critical to the ongoing care that happens in West North Carolina. Mission has, and it's very much related to the caring of individuals in Western North Carolina, we have a thing we call the Mission math problem. Every year, our supply costs and our medication costs are generally going up somewhere in between 5 and 8%. This year, medication costs alone are up 11%. And just to give you an example, the issues are the new chemotherapy drugs that are coming out. We had one child with leukemia. There's a new medication that would be exactly the right medication for that child. It's $500,000 a course. So cost inflation that we can't control is high. So we work very hard at reducing our costs, and I'll tell you how we do that. In addition, 75% of our patients are coming with us with insurance from Medicare, Medicaid, or charity. And our charity has been dramatically going up in this last year. It's very interesting how fast it's escalating. Now, all of those, whether you are with Medicare, Medicaid, or uninsured, you're not covering your costs from that reimbursement. But we don't ask Blue Cross Blue Shield to pay attention to that. We think that's our responsibility to reduce our costs. We do have to have for their beneficiaries a very moderate single-digit inflationary increase. That's what we requested, and we believe in pay for performance. We actually worked with them very diligently to put together their quality program and have for years been participating on pay for performance and pay for outcomes. But we have to have that single-digit increase. Now, I'm a registered nurse, and I have been for 37 years, and my sweet mother, Mama who has died, she was also a nurse. And what she would be saying to me right now is, before you go and talk about needing something, you got to have your own house in order. And that means we got to be reducing costs. And we have. I wouldn't be here had we not spent the last 4 years, and these great team members and wonderful board members, we have reduced over costs on a run rate basis over $250 million. So while we're achieving those high quality outcomes, our teams are every day saying, how can we take out waste? How can we reduce cost and do it most efficiently? And here's the piece that's very important. Not only are they doing that within our clinics and our hospitals, they're actually thinking very creatively about how do we partner with you and the people you serve to make sure we help you stay well and manage your chronic conditions, which actually reduces cost at the same time. So we know we're reducing costs. We even reduce costs that hurt us. And here's an example. You shared earlier the behavioral health crisis that we have in this state. No one knows that more closely than we do. Every day at Mission Hospital, we have usually 50 people that are waiting for access to care. We've been working collaboratively in all of our communities to find solutions, but we have actually an extraordinarily high number of individuals that are addicted to opiates, and in our NICU, 10% of our babies are born addicted to opiates. It's one of the highest in the country. When I first came here, I was just stunned at the level of pain and suffering that we have related to that. Here's what we've done. Our great physicians and nurses in the NICU, generally when you're detoxing a baby, it takes many months and you have to carefully do that. And generally it's happening in a newborn intensive care at a very high cost. Our clinicians got worried that there's better ways to do it, and they were worried that that was actually taking away from the bonding of the care between the moms and dads and those babies. So they worked together, put together one of the state-of-the-art protocols that is now being borrowed by lots of high-risk NICUs around the country that allows us to take care of the baby within the NICU and then to transition early to home with the support of care partners and our pediatric services. What we've done from that is we've got an increase in the outcomes for our children. They're detoxing well, and bonding has gone up, and total cost has gone down. So the real question here is reducing total cost of care. And what I can tell you is for our employees, we're seeing total cost of care go down. For our Medicare beneficiaries that are in the ACO, we're seeing curves that indicate costs are going down. But that's because we're working together across the health system. So where do we go from here? We're ready at a moment's notice, again, Ron has his cell phone on, to negotiate at any time, anywhere. Because we think that that's the right solution, and we think it's nonsensical that it's not happening. Second, just as Blue Cross Blue Shield is, we care about you. And we are focusing right now on just assuming because they won't talk to us that we're going out of network. We have social workers who are supporting individuals who are applying for continuity of care, because we've had several that have had difficulty in that process. We will continue to be arm in arm with you. And we'd encourage you as an employer to look at all your options. Aetna, Cigna, United, the other health insurers, we are all in network and they've been delighted with our rates. So there are options for you that we would want to partner with. So finally, our goal is to collaborate with every insurer. We would love to work with Blue Cross Blue Shield as we're working with others because we want to make sure that you have access to the high quality care.
Okay.
Questions?
Thank you, Jill. Comments, questions by board members? We've got two great presenters tonight because I've never seen this board with so few questions on a topic. Well, I'll just say this. Thank you, Jill.
Thank you.
We appreciate both parties being here tonight, and we wanted to bring you in here and just hear from each of the parties and just get information, and that's what we did tonight. So we appreciate the work that both groups do. Blue Cross has been a great partner to the county, and Mission has provided great services to the county also. So we'll let the powers that be continue to work through the process, and we'll continue to do what we need to do here on the county level to protect our employees and people who are insured here, and that's what we're going to do, just as you're going to both look out for your best interest also. And while you're doing that, we know you're looking out for the interest of the people that you insure and cover and serve and take care of. So with that being said, thank you so much for being here. And we'll move on to the next item on our agenda. Let's take a brief recess at this time. At this time, the McDowell County Board of Commissioners are back in session. We will move to item A under old business. This is the North Carolina Department of Transportation update. Mr. Wheaton, go ahead, sir.
Yes, sir. And I apologize. We have some information that came late after the packet was put together, but we'll make sure you get that from DOT. Again, you've voted last month to move forward with a county-operated transportation department on July 1st, 2018. And again, people see vans right now and say McDowell Transit or whatever on them. Right now, we have a transportation function that is housed in the Department of Social Services, and we have limited transportation opportunities for folks that qualify. We don't have general public transportation at this time. We're one of very few counties that are in this situation still, and we have been attempting for a number of years, upwards of 5 or 10, to we've had studies and analyses and different things on how to move forward. Again, you voted to move forward starting July 1. We communicated that the Tuesday after the meeting last month. The staff person made plans to be out here within the past couple of weeks from DOT. With the storm, they were redirected and were not allowed to travel. So that has been rescheduled for October 2nd. The letter that is not in your packet that we received late Friday was from the Public Transportation Division Director, and it was essentially a welcome to public transportation letter from her, saying how excited they are to work with us in implementing a system. But we get our homework from that. There are about 50 items that staff will have to work with and work on for the next month or so. And a lot of that is turning in our most recent audits, coming up with a proposed budget for a department, a great number of policies that we will have to implement. Some we already have, some will be new, but there's a lot of work that will have to take place in the next 8 or 9 months. And so I am meeting with our transportation staff tomorrow afternoon. I'm meeting Wednesday morning with Lisa Sprouse and some of our Transportation Planning Board members that are going to assist with this. So there's a lot of work to be done. We're ready for it and are excited to move forward on it. And we're glad that NCDOT is committed to working with us. Now there are, so we're working on homework for them, policies, et cetera. Related to that, there are funding deadlines that we will probably get in more detail about next month. But transportation systems have to have, I think probably 100% have to have outside funding assistance in order to operate. And so there are federal funds that are passed through the state that they issue out to counties and cities that would apply. So we will need to work on those applications in the next months as well. And we've been assured that we will have DOT assistance on those applications. So there's a lot of work to be done, but we're up to the challenge, and we will be talking about this, I would imagine, every month up until the system is implemented in July. So any questions about that? And again, we'll forward the letter out just so you can see it, but it was very well received by us when we're unsure how they would respond. So.
Okay, sounds very positive. Capital funding's at 80%, right?
That's right.
Okay. And the Transportation Board Advisory Committee, minimum 12, max 20 members?
That's right. And
Where'd you get that template at? Is that just standard?
They have a
Is that what they
template
supply?
in the letter that was sent, and they have a cross-section of folks from business community, transit riders, human service agencies.
Very diverse.
So that will be a committee that you will appoint that will advise on the function.
Okay, other comments or questions? There being none, let's move on to our next item. No action is needed there. Let's go to item B, Health Department Report Update. And we do have our Health Director, Karen Powell, with us tonight. Karen, good to see you. And we may have you come up too to give an update because you did the other month. And we appreciate the correspondence and how you're helping our county staff with numbers and that kind of thing. But we're very interested, very, very much so, in how we're progressing with our environmental science personnel. So we may call you up in a minute, okay? Ashley, go ahead.
Yes, sir. Again, Ms. Powell gave a great update on where the health district stands in regards to the environmental health area. There's been staff turnover, retirements, et cetera, and they have a great plan for getting back up to full speed there. After the report, you did ask last month that we obtain the costs for having a county-run department. And again, we are in a district with Polk and Rutherford counties and have been maybe for 40 years. So this, like I said last month, this isn't something that we would know on the back of our head or be able to figure on the back of a napkin. So we had to do some research, had immediately contacted Ms. Powell, and they were very, very helpful in providing quite a bit of information, a lot of information that you have. And so you've got that in front of you. Essentially, and again, there is some bleed over in revenues, but Karen can correct me, Ms. Powell, but for the most part, the clinical programs are primarily funded through clinical fees, Medicaid, and state funds. There are some county funds in there, but most of your clinical programs are paid for by external sources, for the most part. Where you get into more of a local cost tends to be in your administration and your environmental health. Environmental health does have the fees that covers quite a bit of that function. So you've got the clinical, you have environmental health, you have administration, and again, we were creating a health departmental paper. And so there's some assumptions in there. And again, a lot of it was provided by Ms. Powell, which was very helpful. But when you look at the costs and the current revenues, as the services offered as of today in McDowell County, you would have a budget shortfall of at least $300,000. So if, and again, I'll repeat that, if you wanted on July 1 to have a county-run health department, you would need to budget with the current services, you would need to budget at least $300,000 more dollars.
What's the penny on our tax rate generate?
A little over $300,000.
Okay.
So this, and you see it in the memo, this does not cover probably all the costs. It does not factor into the additional workload that you would see on our human resource department or our finance department. And again, that's really hard to quantify, but you're adding other functions, more money, and so that there is an impact there. And again, that's not shown here, but you have to imagine, like the transportation function will add workload for the staff here, and we're prepared to do that, but this would be an additional burden.
All right. I'll start out and just say that the goal is this exercise was to see and determine cost to run the standalone county health department. The goal is to stay in the group we're in. I think we're getting a pretty good bang for the buck. The issue, and Karen can speak to this here in a minute, is are the services on the environmental health side being provided now in a timely manner to where we don't have McDowell County people backed up, contractors waiting on approvals to do the work. So with that being said, Karen, come up front and give us an update, okay?
And while she's coming up, I did mention this to Mr. Abernathy and asked if that had been a study in the past or an examination. And he said the shortfall or difference was about the same whenever they've looked in the past, so just for historical information.
Okay.
And if I could add one thing to that too, just, and Ashley and I have gone back and forth about this for some time. He would just ask me questions and clarify some things. But on those services that I sent him, if you went to a bare bones health department and took away the services that you don't have to do, which are 13 of those, you have to assure that they're being done. So just because you're not providing them, you have to assure by the state of North Carolina that you're doing them. So you have to know that there's somebody out there that's going to do that for you. So a lot of counties, for instance, have an FQHC that will take some of those services. You do not have that. So you have to make sure that those services are going to be contracted out to somebody else. So I think that's a legwork that you need to think about too, because you got to think, okay, is there somebody that's going to do family planning? Is there going to be somebody that's going to do maternity? And all those 13 assured services that we provide.
And those 13 weren't in the numbers here, right?
They are.
They are.
They are.
Okay.
Mm-hmm. There's 5 mandated services that the county has to provide. The others you can assure out, but you have to make sure there's somebody that can do that and that you have a contract with them through the state of North Carolina.
Okay.
So I'm sure that's in that memo piece, but I think that's something you need to think about as well. So on to environmental health. So our new employee in McDowell County, his name is Stuart Black. I've probably talked to him about. He he's ready to go now, so he is working on his own, which has been real helpful. We have an employee that did come back from retirement in Rutherford County. He's been working in McDowell County as well. And then we do have the weekend contractors, which, have had, we've had some discussion about them as well, are still coming on the weekends too. So we seem to be knocking them out, but they seem to be continually coming. So when I talked to our supervisor on Friday, I think we're still probably 6 weeks out. We still have an open position that we cannot fill. We've advertised everywhere for that, everywhere. I mean, I don't even know where else we put out to colleges for new grads, just whatever we can do, and we can't get anybody yet for that position. If we could fill that position, depending on who it is.
Is that a McDowell County position too? It is. Where are we at in the process with Steve?
Steve Grindstaff.
Yeah.
He is contracted to come on. He just has to come over and do his paperwork. So he's ready to go too. The state will come out and watch him. So he actually called me today, and I need to get him to come to Rutherford and just sign his contract, and he'll be ready to go. He has a letter of offer to work. We did just hire another retired employee from Haywood County, and he is still the retired piece, so he can only work so many hours, but he'll be working in the week. So he's like our weekend contractors, but he'll be doing week work. So I think he came on board last Wednesday, so I think he's going to be a real asset too. So we just got him on board last week, and he'll be doing week work contracts, so I think that's going to help out too. So we've brought in at least 2 new people on part-time contract. If we can get Steve up and going, that'll be a third. And then we're just still continuing to monitor, trying to get that empty position filled.
Where do we rate in the district with the 3 counties as far as the volume that you see coming in to your?
Rutherford and McDowell are about the same.
Okay.
We have fewer applications coming in Rutherford, but because most of my staff in Rutherford's working up here, we're just as far behind in Rutherford now. So Polk County's probably just about maybe 3 weeks behind, but only have 1 person there.
Right.
So so that's not too bad in Polk. But Rutherford and McDowell run about the same, but we get more applications in McDowell County.
This, and Ms. Powell, Karen will know this is obviously, this is not unique to our county or our district. I talked to the Henderson County manager about 3 weeks ago, and he was clipping out the McDowell News article to send to his legislators along with the article from their newspaper about this problem. So if Henderson County is having a problem getting environmental health specialists, it's a statewide problem. I'm sure they can pay a lot more than we're able to here.
We need to lobby our association. This sounds like a statewide problem then.
I think it is. And we did send letters to the different state level folks and our legislators, but it is.
Legislative goal priority, it sounds like, for next year.
And the problem also, you're right, and I'm on a listserv for health directors, and I continually see emails from other counties looking for the same positions we're looking for. They're hard to fill, and right now, because there are so many, it's the market for the employee. So they can ask for whatever they want, for salary, and they go where they can get that. But I did get a call from the state level. They had received your letter, and he would be over environmental health at the state level, called me and said, what can we do to help you with this problem? I said, I need an employee. I need employees. You need to help me recruit employees to come. That's what we need. They're not going to change their process, but if they can, put out what we need, then that may be helpful as well. So.
Where's your closest schooling that you'd have to take, Karen?
Closest, I'm sorry?
Closest school, college that have to attend to get certification. They're not going to go. Wake County EMS hired 51 employees to fill 43 positions. Iredell County, 16 paramedic positions going unfilled. McDowell County, we're in the same shape.
Right.
People just absolutely do not want to work.
They don't. You're right. And anybody that graduates, say you graduate from a 4-year university or college with a science background, say I graduated from whatever university with a biology degree, I could come to work for the health department in environmental health.
Right.
We send them to state training, they get the training they need, and they just have to have those specific science classes. Now, NC State has a specific, I think Western Carolina has a specific major for that.
That's what I was looking for,
Yes,
I guess, is
yes.
to make sure,
Mhm.
okay.
We have looked at numbers, Karen, you don't mind me calling
No.
you Karen, don't you?
No, I don't.
We've looked at numbers here on a standalone department or county on this issue. Maybe we need to look at each county putting more money into this in order to make it more attractive to these prospective graduates from
Right.
college. Maybe we could all do that, save money on every, for the three counties.
Well, and Rutherford had wanted to talk, and I think we did in one of our meetings, Rutherford and McDowell going in together and getting that position just for those two counties, since they're the busiest, and not splitting it with Polk because they don't need it as bad. And we had that discussion before to maybe put that money in there to do that. But I'll be honest with you right now, when we get, the people that we've been hiring lately, we're paying what they're asking, and we're going into our fund balance to do it. But we have to have those positions, and we know that. There's no way around it.
But you've got a state pay grade though, correct? You got a state pay grade for those people coming
We
in
do.
that you meet.
We do. We do. We do pay grade our employees, so you're right. So there's a maximum there.
Right.
Unfortunately for us, the maximum is money that we just typically don't pay, but we're being forced to do that right now, and we are.
A lot of times people don't mind to pay a little more for a service if they get the service done in a timely manner.
Yeah.
Right.
Within reason. Most people, within reason, will go ahead and be okay with that.
And I want to update you on this too. We discussed this, I think, last time, especially in McDowell County, when big developers will come in and buy all those applications, and they're not doing anything with them right now. And so they're ahead of the I need mine right now. So we're really looking at those and trying to pull those out to put the right here, right nows on top of that. Because if it's a development that isn't building, then we need to put the more,
Right.
we're starting to build today on top of those. So we're really looking at those applications and kind of seeing what's what on.
That's the kind of information wants us to stay in the district.
Well,
Hearing that, I mean,
yeah.
it's.
Well, that's what needs to happen. We
Yeah.
can't put applications
Home center.
above ones that aren't moving.
If I may, speaking as a budget officer for a second, ancient history for the health district, all three counties didn't have to pay in as much for their contributions because, for the most part, they were offsetting some of the losses with the home health agency.
Yeah.
And so that was a moneymaker for the health district. And when that was not a moneymaker anymore and it went away, the three counties were looked at by the previous health directors and said, you guys are going to have to increase your contribution. And so going back probably about 5 or 6 years now, each county has been increasing the annual contributions. And so in the last 2 years, we've gone up about $90,000 in the contribution. And there is another like 5-year plan to increase that over those 5 years.
What do we pay now? What do we pay this year?
It should
Give
be
you
on
to
there.
the nickel.
It should be on that.
$335,000 is the county contribution right now.
And that would be our budget shortfall projected if we did our own, right?
You would be paying
Additional, it'd be 600,000.
quite a bit more.
Well, yeah, I mean, money you'd have to have.
600 plus.
How much more in the next 5 years we're gonna pay?
The problem is, though, and I think I'm reading this from Karen, is there's just not people out there to get. And so, until that happens, the problem's never going to be solved.
No matter if you're standalone or if you're
Doesn't matter.
in a district.
So,
Exactly. Because if you go standalone, you're going to be looking the same employees.
Exactly.
Yeah, we would actually be in competition, wouldn't we?
To Mr. Crawford's question, I can get that number. I don't remember off the top of my head. I have the
I don't
paper.
have that plan
but
in front of me.
It's about, I think about $30,000 more each year that the county managers and the health director sort of had a verbal commitment that we would try to, the request would come in and we would try to do that. It's not in writing, but it is a commitment we'll try to reach. To the point about the staffing, and again, I'm not advocating or not, but just if you decided you wanted to do a health department, you need to know the staff wouldn't automatically come to the county.
Oh, yeah.
That would have to be something to figure out.
Their
I
employees.
doubt Ms. Powell would
Lady right
want to
there.
commute up here, so you're going to have
She
to
should move in with us. She would.
you'd have to hire a health director, and they don't necessarily grow on trees. So you would have staffing issues that could be overcome. I'm not saying they couldn't be, but you would have to find these qualified people for these positions.
We would have to get a verbal commitment from Karen to come with us before we pulled out, right? Is what you're saying?
Let's pay for mileage.
Maybe I could bring my employees with me. Yeah, and those are definitely things to think about. But, and in the big scheme of things as well with the district, we get about 11% of our budget from all three counties. Most counties, standalone health departments, get around 75 to 85% from their counties. So a standalone health department gets between 75% and 85% of their budget from the county. We get 11% to 13% from all three counties. So that's a big difference. So the rest of that is made up from Medicaid, some cost fees, and those types of Medicaid, basically.
Well, rest assured, McDowell County will do what we need to do after receiving information tonight to make sure you're successful in recruiting these environmental health technicians to keep the backlog down.
And please know that we are doing that, and we are recruiting. As we actually this week have put it out in some more. We're going to the Charlotte paper. We've gone to the Asheville paper. It's out on all the social, internet sites where you can advertise. We're doing it in the county websites, which typically we haven't been allowed to do, but we're doing that now. I mean, we're getting it out there everywhere we can. So if we could get that one.
Please understand that the point in doing this standalone study had nothing to do with what we think about you and the job you're doing.
I appreciate that very much. Thank you.
This is information, I've been on this board 4 terms, and this is information that we requested. Now, you referenced a previous number, but no,
Maybe a long time ago.
we were never privy to that number. And we have inquired about this and always received word back, it's not cost effective. So now we know the information, and we can make a decision.
When he emailed me, I started scanning our budget. This is all our budget papers for every program we do. So you're welcome to look at that anytime.
And we appreciate you helping staff, because, going through the process of looking whether or not to be a standalone or whether to stay in the group, you had an interest to try to keep McDowell County in the group because of the impacts to your budgets now. So on behalf of our board, because Ashley did make comments through the process about how helpful you and your staff have been, so we appreciate that.
She's probably said, I'd be glad to get rid of that crowd.
No, not at all. Not at all. Thank you. And I appreciate your understanding.
Thank you.
Okay, all right. Thanks, Karen. Have a good evening. Any more comments, questions for staff? There being none, you've heard information, guys. Let's give a little feedback to staff now that we've got the information. He's not really asking for that tonight. I don't guess, but
I don't think it's anything we need to move on tonight or
Yeah.
in any way, shape, or form. I think we just need to feed off of the information we got and go from there.
Okay. With that being said, let's move to our next item under old business. This would be item C, shooting range update. Mr. Wilton, go ahead, sir.
Yes, sir. Definitely a project with a lot of interest. We've not seen a lot of movement from wildlife as far as physical movement, as far as visits and that sort of thing. So we did want to continue our barrage of phone calls and emails to their staff, which I think I mentioned last month, we alternate. Mr. Harmon will email or call, and then I'll do the next week. I did get a rough schedule from the wildlife staff, and you see in your packet. And again, I'll read it out so folks can hear it. What they're looking at and what they anticipate, and again, it's subject to change, but what they're telling us is they anticipate doing a formal sound test next month, which is October, and then they would take those results and have a public meeting in December of 2017 They would take the results, the public meeting comments. My understanding is the next meeting of the Wildlife Resources Commission, their board, is in February. So they would take all that to the Wildlife Resources Commission themselves for formal permission to proceed with the development of the range. So everything they're doing, they have permission to be doing it this far, but actually construct, they would need further permission. They've said it would take until September 2018 to complete the design and permitting, and then from that stage on, construction would be complete in June 2019. And so again, this is subject to change. There's weather, there's environmental permits, whatever that can mess with the schedule, but this is what they're hoping for right now. I did ask if there was anything we could do to help speed it up, and I'm waiting on that answer. I'm guessing the answer is no, but I appreciate the offer, but we will ask if there's anything we could help to speed it along.
Are we still in a competitive situation?
I would
Bert?
just like to, if I may, I would just like to say that I would like for, I definitely, personally, and these other guys can state their opinion, I would like for either you or Ron to call them once a week and see if we can get an update. You know, maybe we need to aggravate them enough to, you know, this is dragging out. It's ridiculous. And the state, you know, the state, that's the way it is. It's dragging out forever.
And we don't want to lose this to Burke County. Burke's back in play, or was back in play.
They are.
And McDowell County said we wanted it when Burke said they didn't want it after pressure by the public. We want it, and we want to have this opportunity for our people to go out and recreationally target, practice, and shoot. And I agree with Tony. We don't need to let the grass grow under our feet on this one at all.
And maybe they won't tell us anything different, but at least we'll be bugging them.
I think
And I wanna bug 'em.
I think they're used to. I think we're buddies now, so I think they're used to it. But no
Okay.
sense of resentment.
All right, no other comments, questions? Move to item D. This will be a courthouse project update. Mr. Wilton, go ahead, sir.
Yes, sir. This is something we haven't talked about in a few months because there's not really been an update to share, but there is work behind the scenes proceeding, so I thought I'd better remind folks that it is going on, including the board. Again, you engaged Chuck Hamrick, the county's architect, a few months ago to begin work on the courthouse renovation project and the additional courtroom. So again, the scope, for the most part, includes the addition of a courtroom and windows and heating and air for the older structure there. And so he is working on the drawings. He has met several times with Terry and myself. We've had numerous phone calls. He's met with court officials and made adjustments where necessary on his preliminary drawings. So what he'll do within the next month or two is then bring those back to us. We can have a work session. We could do it one-on-one. It's up to you guys. But we want to make sure you know what's going to be in the bid documents before they go out and have some comfort level. So the plan, as you see it, would be to advertise construction bids December 11th. We would open bids on the 11th of January. We would have a special meeting on January 22nd. And then we have until February 1st to send that to the local government commission. And so that would have to have the banking bids, the construction bids, the minutes from the meeting, et cetera. March 6th would be the LGC meeting where that commission would review the request and hopefully approve it. And the day after is as early as we can sign the contracts. And so they would start as soon as possible after that. It helps us to have this schedule for warmer weather for the contractors, but also for the impact for parking, whatever that might be. It does help us for winter weather, hopefully being in the past at this point. So we are planning a lot of these different areas to be prepared. And we will, again, try to have the drawings. We can have them at the October or November meeting for you to look at and make sure you're comfortable with them. Any questions about these? And I will say before, a lot of this is based on the local government commission schedule. This is as fast as we can go to have an approved audit and to meet their schedule. So we actually went to March 6th and went backwards, factoring in 90 days for the public hearing. So this is as fast as we can move.
Does, I understand the schedule, are the plans completed?
They're not
Where is he at in
complete
the
yet.
process of those plans being completed?
He, if I had to put a percentage on it, I'd say for the addition, he is probably in the 90% range. I mean, he's had preliminary drawings before you, but the actual construction drawings, he's probably in the 90%.
And he understands this timeline too, correct?
Yes, sir. It's been shared with him before it was shared with you to make sure he was okay with the dates, and we had to tweak a few here and there, but he had no problem with them.
All right, other comments, questions? There being none, let's move to item number E under old business. This would be the Stacy Hill Road Water Project. Mr. Wooten, go ahead, sir.
Speaking of local government commission, local government commission approves all debt issuance over a certain amount in North Carolina. So if we, well, I'll get there in a second. The Stacy Hill Road project is something we've talked about here previously. We have some grant funds from the Environmental Protection Agency that will expire in about a year or less. It's about $365,000, and we would like to spend that money and not send it back to Washington. We've had permission from this board to look at doing the Stacy Hill Road water line. And so we've worked with our engineer to do the plans on that and permitting. In the process, we had a pre-planning meeting or phone call with the local government commission staff and talked about this project and indicated the total price is about $1.2 million. The grant funding is about $365,000. So we financed the balance of about $800,000. And they asked, well, how are you going to pay that back? And honestly, we would have to pay a good portion of that debt payment with property tax revenues. Our system is not large enough to have the water sale revenue to pay our debt service yet. We're very small. So the city of Marion can borrow money. They have 7,000 customers. They can borrow money to extend water lines or repair, replace, and they can use the revenues that they make on their system to pay the debt. We're not big enough to do that yet, and will not be for a while. LGC in the last number of years has taken a harder approach to these type of funding requests, financing requests, to where they are not approving based on the staff's information requests where the enterprise fund is not paying for the debt. So we would maybe use a little bit of our water sales towards the debt, but since it wouldn't be 100% for the debt payment, they do not anticipate LGC approval. What does that mean? We can't borrow $800,000 without LGC approval, so we have to back up. There's really two options. We either make the project much smaller, we borrow a smaller amount.
Is this a match fund?
The 365 does require a match from the county. That's right. So in order to move forward, you have two options, honestly. If you want to do the entire line, you have sort of a breakdown in front of you. We had 365 EPA funds. We have a water reserve that was set up a number of years ago when the system was started of about 100,000. And then we could borrow about 415,000 from a lending institution, and then the balance, about 370, would have to come from local funds. We don't have that budgeted, so that would have to be fund balance. So If you wanted to do, again, the entire line, you're probably looking at about 370,000 of a fund balance appropriation. The other option is to do a shorter line where you are financing no more than $415,000 and then using those grant funds, and you would probably do about half of the road. So again, what we're talking about is going from the intersection with Harmony Grove and Fairview back to US 70. So
If you don't do the full amount, does the half of the line get the customers that need the water?
if you did half the line, we would recommend that you start on the southern section because that's where the majority of the houses are.
The goal was to be able to loop this so we're not paying
Right.
for water at the end of the
Going
line that's
on the
being
ground.
dumped on the ground. Well, to me, it'd be just, my opinion, for myself, would be to go ahead and move forward and complete the whole line and do what we need to do to complete it, build your customer base. That's what we're going to do just over time. Future boards, keep building that base up, providing the service, and eventually one day, a future board might be able to bar against the customer base. But one question I've got, though.
Yes, sir.
Going back to the money that was due to be lost, what date was that going to be?
The date is floating right now. It was originally going to be December of this year, and they have extended that probably till about June 30th.
How much was that money? How much?
$365,000,
Okay.
and possibly to August.
So that money can still come on this project?
Yes, sir, it can.
Okay, all right. Because I don't want to lose free money.
Right. And another possibility, this project probably will go into next fiscal year. There's no way I can see us budgeting $370,000.
You just got to bite the bullet.
Probably, we may have a little bit that we can budget out, but the vast majority would be fund balance.
The fund balance is what, 25%?
Between
Give or
20 and
take.
25.
The state says you need 8%.
Right.
You've got a little bit of cushion there, don't you?
We could handle this if we had to. It's not what we would obviously
It's
prefer.
not ideal. It's not the ideal situation, of course.
No, and let me give my opinion on that.
Go ahead.
Since I've come on the board, we've dipped into our fund balance several times. And I just want to caution us, you can't do that at home. Take out of your savings without some way to put it back in there and last long.
I'll say this.
We
when
need to be careful.
When I came on this board, that's right, man. When I came on this board, and Barry came shortly after, we were, state was watching, we were on probation. We had a fund balance of what?
About 3%.
3%.
3%.
So over time, and you're right, this board has been dedicated to building that fund balance up. So we've got some room, and you are right, you don't just continually dip into it. But this is going to generate revenue and
Sure.
help
Understand.
the people, so I think it's a positive thing. I know you think that too, but it's a good comment, thank you.
We just need to be careful. That's all I'm saying.
Other comments?
I like the idea of moving with it, if we can.
Okay, Ashley, you're asking for action, correct?
Yes, sir, I'd like direction.
All right, gentlemen, staff requests direction on how to proceed. So what is this board going to tell our staff to do? And I will accept the motion.
I'll make a motion to approve using of the fund balance up to $371,000. Proceed with the full water line.
I'll second that motion.
Okay, discussion? All those in favor of the motion say aye. Aye. Any opposed, like sign. Okay? Thank you, Jim. Let's move to item A under new business, administrative items. Mr. Wooten, go ahead, sir.
Right, we've got two items here. The first one, we could spend many hours talking about, and I promise I won't do that. We'll do minutes. Brief history, 1983, the county received a donation of property near Addie's Chapel Church. And I know that based on deeds, but also looking at the minutes from that meeting, there was no discussion of the property donation. It was just acknowledged and received. What we have now determined, thanks to technology, and better tax maps, et cetera, is that the property that was donated was actually someone's home. And so the short story is there have been paperwork errors on a number of deeds going back at least 100 years. This isn't something the county attorney at the time messed up on, or anyone else in that era. It's just something that we've figured out by a lot of research that there were a number of deeds that were there were paperwork errors. And so we have met with the folks that are affected by this. The county has no interest in owning property, especially where someone lives, as you can imagine. And so the easiest solution is to deed the property to the people that live in it.
I've got a question about.
Did they not question the fact that they were paying no taxes on it?
They are paying tax, and then you have, essentially what you have are a number of houses that are shifted. And it goes back to lot numbers. The lot numbers are wrong on the deeds. And so folks in the home we have are paying taxes, but they're paying taxes on the wrong house. And so we want to straighten it out so everyone is paying the taxes on the right houses. We no longer will own property, and we move on, and it's a happy ending.
Well, what was the intent of Mr. Roy Davis? Did he want the county to own property, and he donated that, right?
We don't. He's passed away, and we have no idea on the reasoning at the time. There's no reference in the minutes, and that's just.
Well, the deed transfer. Let's talk about the deed. So there was a transfer of property from this man to the county,
Right.
and you're saying is that where they occurred at? There or down the road?
We think.
Because I mean, if the man intended the county to own something, he wants the county to own it, or did want the county to own it.
Did he not?
We wonder if he figured out there was a problem and was dumping it on the county, to be honest. So, again, the solution is to deed it to the right folks and sort of make the problem.
I don't know that you know the right folks have the property, just to be honest with you.
We do. We've investigated it with the county attorney, and we've figured out the proper chain.
Well, what parcel does the county own then? That one that.
There's no property out there that the county was intended to own. It's really a paperwork issue. So what we're asking is for you to essentially deed on paper where folks have a house that they have lived in for decades beyond this, where we're deeding it in paper to them, to the house they actually have lived in for 50 years or longer.
I make a motion, we deed it to them and be done with it.
Second.
Discussion?
My own question is how you deed something back and never have it to begin with? How you gonna do that with?
That's why we have to do it on
That's why
paper.
we've got a county attorney.
And the county attorney has reviewed this, and this is his preferred method.
Okay.
I'll just say this, I'm voting against it because I don't know the man's intent. It sounded like he wanted the county to own property, so that's going to be my vote. All right, all in favor say aye.
Aye.
Any opposed, like sign? Aye. Okay,
Again, I could spend many hours getting the details about it, but I don't think we want to stand here. The other item was an occupancy tax late fee waiver for a business that were eight days late, and they always pay on time. We'd ask that you.
what's the pleasure of the board?
Make a motion to approve request.
Second,
Second.
discussion. All those in favor of the motion say aye. Aye. Any opposed, like sign? Okay, let's go to tax matters. Mr. Wood, go ahead, sir.
You do have some charge-off, in addition to the normal tax matters. You have the charge-off of the uncollectible 2006 taxes, and then you do have the standard releases, refunds, et cetera, from the tax officials.
Okay. What's the pleasure of the board?
Motion to approve all tax.
Second.
Okay, discussion. All those in favor of the motion say aye.
Aye.
Any opposed, like sign. Motion carries. Let's move to the next item, board appointments. And we have two boards. This is a first reading, so no action is required. First reading for the Adult Home Care Nursing and Home Advisory Board. Leah Hoppy Robertson is applying for reappointment, first reading. The second is the Industrial Facilities and Pollution Control Financing Authority Board, and this is the first reading too. Let's move to reports, communications. Does county staff have anything, or commissioners?
Just a couple of invitations that you have. The Community Unity Service is this coming Sunday at 3 p.m. At East McDowell Middle School. You've also been invited to attend a joint meeting with the Burke County Commissioners on Friday, October 6th at 11. That would be at the Lake James State Park. Again, the purpose would be to recognize the 30th anniversary of the state park and the partnership between the two counties. I've indicated that it is a Friday at 11, and it may be difficult to get a quorum, but we will do our best to have representation.
Any other meetings or appointments? Gerald, the high school principal did come by just prior to our meeting, give you an invitation for ribbon cutting ceremony Friday. It'll be homecoming at McDowell High at 7:10. They'll be doing a ribbon cutting for the high school football field. And it will be McDowell High School versus Hickory. It's been a while since we played Hickory High. But it's going to be very interesting. It's a great night for homecoming, great night to do ribbon cutting, and he wanted us to be a part of that. He talked to me at school, and he came by and just gave us a quick invitation to do that. That'll be this Friday. And you do get in the game, no charge.
It's a reason to go out there.
Any other announcements? If not, we'll move on. Any other reports, any other communications at all? None? Okay. On the citizen comment, we have anyone wishing to speak tonight, if you will. Anyone wanted to sign up?
At this time, do I hear a motion to adjourn?
Adjourn.
I make a motion.
All right, discussion, all in favor say aye. Aye, opposed, like sign.